Good morning. You're listening to For the Health of It on URL Radio. Stacey Sturm, and in the studio with me again this week is the owner of Daymark, Nick Dobrzelecki. Good morning.
Good morning, Stacey.
How's it going with you?
Wonderful.
Good. Today we're going to be talking about something that's probably going to be like a 3-hour long segment. It's politics and healthcare. Politics is really heating up, but there's a lot of things that we don't think of behind the scenes. We always think about like how political things affect us personally. And sometimes I think about how political things will affect me as a business. But the biggest debate right now is healthcare, and you're like smack dab in the middle of it.
We are. We are, absolutely.
So now with when Obama took office, huge changes.
Correct.
With healthcare. So what did you guys go through with that?
Well, kind of backing up even before that, there was the environment with healthcare was already kind of in a fast-paced moving. And so, even back in 2000, there was policies and some demonstration projects that were put in place to kind of bridge the gaps within the healthcare system.
Sure.
And so for, 6-8 years, we were already kind of dealing with a lot of potential changes and trying to prepare and be proactive for these changes, because making changes in healthcare is not an easy thing. It's not an easy fix. We got big facilities to get physicians, nurses, clerical people to kind of change their culture on how they've been operating for so many years. It takes years to do that. So
yeah.
So we've been working for, like I said, almost a decade, with some of these big changes back, when President Clinton was in office, and, they sparked that whole debate then. And that kind of led to a lot of potential changes. So then when President Obama got into office, what happened was that they restarted this whole debate about health care, and, they wanted to go back to the drawing board. Yeah. Basically say, okay, we want this is how we want the healthcare to look like.
Yeah.
A couple things happened. One, it got pushed really, really quick.
Yeah.
And they came up with this legislation that was, I've never seen it, but I heard it's about like a foot and a half thick of paper.
Oh, it's like 2,000 pages.
Yeah, exactly.
And then we wonder. I still think if you're like a congressperson or a senator, you should read the legislation that goes through. But sometimes I don't blame a man. When I see a document like that, that's like 3,000 pages.
Exactly.
That's crazy ridiculous. Even if you read it all, there's no way you could comprehend or remember everything.
Absolutely. And a couple years later now, as we're still kind of debating some of that, we're still trying to read that and trying to figure out what it all means.
Yeah.
And so what happened was when that went into effect, then that kind of stopped a lot of the progress that we were working on before.
Yeah.
And so what that did to the healthcare system was we had to be reactive instead of proactive again, and start trying to say, okay, how are we going to start meeting these new requirements? The new requirements, I think the majority of the new requirements are not bad requirements. I think they had the right intention. I don't know if they're being implemented the right way because they're trying to be implemented so quick, and people didn't look at all the details and what all the hurdles that were going to be, and getting those addressed ahead of time. But what happened, so what's happening to the healthcare system is we're trying to figure out, okay, which direction we're going to go in. And now they're debating about, are they going to repeal this? Well, they repeal this, then what does that do to us?
So do you almost just hope that Obama stays in office just so that you have some kind of consistency for another couple of years?
Not to get into my whole political beliefs, yes, absolutely. I would love right now for stability within the healthcare system. What we need is a plan.
Yeah.
We need a plan. We need to know the course that we're going to go. And until we have that course, we can't properly prepare. Like our organization that does medical coding, we've been preparing for the big change that was supposed to happen next year in October of 2013 called ICD-10.
Yeah.
It changes our whole data set. And we've been preparing that for about 2-3 years now. We were just getting into the process to educate our coders, start training our customers and that stuff. And then they just made an announcement that they're going to delay that another year.
Oh, nice.
Right.
Yeah.
And actually about 2.5 months ago, they made the announcement that they intend to delay it. Well, then when they intend to delay it, what does that mean? Do we continue to work on it? Do we,
how much time are you going to waste now?
Exactly. Took them 2.5 months to make the announcement that they're proposing now to delay it. And now we have another 30 to 60 days before they can say, here's the final rule. And we're kind of going on the assumption now that they proposed it. There's going to be some debate, but they're probably going to postpone it another year. So what does that do to our organization? Well, anything that we've worked up to this point, we kind of have to put on hold for a year.
Yeah.
We will work on some things, but but even the cost of delaying some of these things, in I think it's the Health and Human Services report that did this proposal, they're saying that the cost is going to increase the cost of these organizations by 20% to implement ICD-10. That's $1 to $6 billion additional costs that these organizations are going to have to incur over the next couple of years. Now, there are some organizations that procrastinated and weren't ready.
Yeah.
And, they're the ones that are going to come out of this, the best. Now, what's going to happen is more organizations are going to say, you know what, we'll be procrastinate more and more of these changes down the future. What does that lead to? More we procrastinate, the more costs it's going to add to the healthcare. And some of this is the environment of the politics right now. We obviously have the two-party system that can't get along, and
because even if Obama's in office for 2 more terms, somebody's eventually going to come in and want to change everything he did just because he was a Democrat and they're a Republican.
Absolutely, and some of the stuff, and I can see that with some politics. You see that with the judges that they put in office and appoint and stuff like that. And unfortunately, our healthcare system is run by politically appointed people.
Yeah.
Now, I don't know a better suggestion, because you don't know if we want to elect these people or what we want to do, how we want to put these people in place. But unfortunately, the politics is running our healthcare, and it adds to incredibly increasing amount of cost.
Yeah.
By keep on switching back and forth.
Well, and and it's not just healthcare. I think the problem is when they're running all of the big major systems. You have your healthcare. They're also running the economy, which is another whole thing.
Right.
And sure enough, then soon as another group takes office, they sweep out the old people. They make changes, and there's not a whole lot of consistency.
Correct. And I think that consistency is obviously the big is the big problem. I think that's probably the biggest underlying part that nobody's really talking about with the healthcare system. I mean, even with this whole debate, nobody was even talking about what all the projects that we were kind of already working on with demonstration projects and stuff. And then the healthcare reform came out and said, hey, we want to come up with these demonstration projects and we want to start them in 2012. Well, wait a minute. We're already in the stage 3 of the same demonstration project and ready to go to Congress and saying, hey, this project is showing good results. We want to implement this across the board, and this would have benefits to the whole healthcare system. Instead, now we've delayed this whole potential change in the healthcare system by another 4 years, which, just spinning the wheels constantly. And it's very frustrating. It's frustrating to me as somebody in the healthcare arena. It's very frustrating as a taxpayer knowing how much money is being, spent and respent on the same thing over and over again.
Yeah. We're going to talk about some of the hidden costs of healthcare coming up in another show, but do you think some of it might be too because our government is sort of it's made up of a jack of all trades? If I were to be vice president or head of some kind of appointed to whatever position it is, there's no way in hell I could know what you are going through on a daily basis. And so a lot of these people that are in these positions, they just don't relate. We need like an undercover boss. Like I think Barack Obama needs to go undercover and just go to all fractions, segments of the things that they are governing and figure out how it all works because they just have no idea.
They don't, and our system is so complex now that there's so many little nooks and crannies, and everybody's worried about, spending $20,000 on a project to study migratory birds, and okay, that's $20,000 we could save somewhere else,
Yeah.
But there's such bigger pockets within the healthcare system that nobody ever really sees, and some of the stuff is necessary, but people when the at the president level, vice president level, Congress, when they're making these recommendations, they don't understand how it's all worked together. Or they may have one legislation group that will say, like the AMA, that says you have to get rid of this because it's adding cost burdens to the physicians.
Yeah.
And so they say, okay, we love the physicians, which we all love. We all need our physicians. We all want them to make money because we don't want our physicians on welfare because that doesn't.
We don't want them to go away. either.
Exactly.
Yeah.
So, we want them, but when they make these recommendations and nobody follows through, why on the other side of things and how that's going to impact all these other parts of the healthcare system, then there's detrimental things. There is a couple programs out there that are supposed to be independent boards. One's called the MedPAC, the Medicare Medicaid Advisory Panel, and and the problem, and that's made up by physicians, nurses, pharmacists. I mean, it's a pretty big section across the country, and they meet. The problem is too, even with them, they meet and they make recommendations to Congress. But like even in the home health industry, and they've admitted this a couple of years ago at a conference, that they don't understand home health.
Yeah.
But yet they're responsible to make recommendations to Congress about what
and
to
how
do.
you guys are going to go,
exactly.
how you guys are going to run.
And then so Congress says, okay, this is what MedPAC says. Well, so they're, it's the blind leading the blind sometimes.
Their advisory panel is people that know just as little as they do about whatever your industry does.
So.
Now, do you find that, too, being home health care, too, there's not a lot of people that really do know? Because there's been so many changes in home health care over the past couple years. People are being able to stay at home more and more now. Do you find that that's also complicating things?
Yeah, it is complicating because, we, as a home care industry, we have to do a little bit better, even telling the country what we can do. We have people at home that are on chest tubes and on vents that it's cheaper to have them at home, and they like that quality of life better at home than being in a nursing home or being in a hospital.
For sure.
But there's even here locally, there's physicians here that don't even understand what home health can offer, and so. But by us having to be so reactive to the healthcare reform and all this other stuff, we're always trying to make it just until the next requirement is put into place that we don't even have time to be proactive, and do some of this other stuff. And that's why I keep on saying, if we just had some standard, some time over the consistency over the next couple of years where these are the plans, we can say, okay, I'm going to put something in plan at my organization that's going to also help us for the next thing that occurs in 2014 and 2015. We'll implement that today. They'll meet all those needs, and then when in 2014 comes, I can be more proactive and, on our quality and making sure that our nurses are documenting better and all that type of stuff. But we're always just on this reactive mode right now, and it's just it's very hard, and it's just not health or home health. It's the hospitals, physician offices, it's everywhere, and so
Now, speaking on home health, if people have any questions about some of the things, hey, by the way, I saw a story now, the new trend, the new hot diet is called the home health diet. What they do is they take a feeding tube, and these brides now, have you seen this story?
No, I have not.
You know where I'm going with this, right?
Yes.
They've quit eating for 2 weeks, and they just do IV. They just go through a feeding tube for 2 weeks with nothing but your basic meal packs, your nutrients. And they're losing like 20 pounds in 2 weeks. This is becoming increasingly popular now in the United States as a diet fad.
That's just crazy. I think, people are so used to extreme things, and that's normal, and that should not be normal.
That's not normal.
That is not normal. I couldn't imagine putting myself through that, just to lose.
They're walking around with the thing up their
crazy.
nose and the little packet strapped to them, and they're just going to work and going to the store like they usually do.
Oh, that's just...
See, I thought you as a home health care provider would appreciate that.
Yeah, I don't know. I'm kind of speechless to say how to respond to that.
Because you probably work with patients who, they are... being fed through a tube, and they're not liking it.
And they're not happy. They're not happy at all. I put those tubes down people, and they're not, kicking and screaming.
They're not liking it. That's not a choice that they're
No, and
loving.
they're ripping them out and having to put them back in, and these people are doing it,
voluntarily. As a diet.
Just for a pretty picture at the wedding.
Yeah, they want to make sure they fit into their wedding dress.
That's crazy. And it has to be unhealthy, too. Oh, my goodness.
But now, if somebody is looking at possibly, they know somebody who's looking at home health care, or they know somebody who's currently going through home health care, if they have any questions, how can they get a hold of you guys at Daymark?
They can call us at our main number, 937-885-5918. Just press 0 for the operator, and they will transfer you to somebody that can help answer some questions. You can also go to our website, which is www.daymark.com, DAYMARCK.com.
Perfect. Well, thanks for being on today,
Thanks, Stacey.
Nick. I'll try to wow you and dazzle you with another horrible story next week.
Great. Thanks.
You're listening to For the Health of It on urlradio.net.